I'm chatting with Dr. Jeremy Oates, who is a urologist, specialist based at the Christie Hospital in Manchester. And in prep for International Men's Day on the 19th of November, one of the issues we wanted to discuss and get people talking about, get the men of Manchester talking about, is testicular cancer. So Dr. Jeremy has really kindly agreed to have an interview with us about that, and hopefully that will get the ball rolling and we can get some great conversations and get that subject out there. So hi, how's it going, first of all?
Not too bad. Busy day as always, but not too bad.
Great stuff. Okay, so can you tell us a bit about yourself, first of all?
So I'm a urologist based here at the Christie. I've been working here now for for about 7 years. So I've got a specialist interest in men's cancers. I do a lot of prostate cancer work and I do a lot of testicular cancer work here as well. Christie itself is one of the biggest centres in the UK for dealing with cancers, obviously in general, but in particular specialist men's cancer treatment.
Great. And about testicular cancer, which men are most at risk, and why is this?
Testicular cancer, it's unusual in cancers because normally when you think about cancer, you think about diseases that are affecting older people, whereas actually the most common age to develop testicular cancer is between the age of 30 and 35. We do see younger men than that, so quite often men in their late teens going into their 20s get testicular cancer. But as men get older, actually the risks of testicular cancer goes down. It's very rare that we see men over the age of 70 diagnosed. So it's predominantly a younger man's condition, unlike most cancers. Now, we do know there are things that put men at risk of developing testicular cancer. And one of those things actually happens at birth. So most men, when they're born, their testicles start off either at the very top of their groin or actually inside the tummy. But in the first few weeks of life, they drop down. And that's because testicles develop better on the outside than they do on the inside. Now, if they don't drop, actually, it can put them at risk of getting problems in the future, either with the testicle not working properly or even developing cancers. So one of the most important messages we get out to dads out there is if you have a baby and their balls don't drop, they need seeing and they need treating, and actually need treating quite soon. So we actually encourage people to get that done before the age of 6 months. Now, as an older man, if you've got a brother who's had testicular cancer or a dad who's had testicular cancer, that increases your risk as well. So they're a really high risk group as well that we need to be concerned about. Now, there are other rarer risk factors that can go on, but they really relate to people who have previous problems with their testicles as well. So realistically, the people we worry about the most are men who've had testicle problems as a baby or who've got family history of testicular cancer.
Right. Okay. So in terms of the testicular cancer, how common is it in Manchester? Is it quite prevalent here, or? It's
in the whole of the UK, it's about the 17th most common cancer we see. So it's not uncommon, but it's not common either. Now, Manchester has slightly higher rates of testicular cancer than the rest of the UK. Now, we suspect that's because we have a higher student population in Greater Manchester than you do elsewhere in the country. So what that means is men are proportionally younger. So we see more younger men with tumours. In terms of environmental risks and things like that, there doesn't seem to be any big factor. But what we do know is that unlike a lot of cancers, deprivation doesn't seem to be a causative factor. So it seems to be more the younger men that develop the problem. And obviously, if you have lots of students, you have lots of young men, therefore we see slightly greater rates. But the treatment rates are very, very, very good in that situation. So again, like I say, it's very different to other cancers.
Right. So yeah, we've got 98,000 students at any one time in Manchester. So yeah, that will skew it up, won't it?
And if you look at the numbers in general, there's about 7 cases per 100,000 men at any one time. So in that kind of number, you do see those coming up quite significantly. So in Greater Manchester, we see probably within our network between 120 and 140 new cases of testicular cancer a year, which sounds a lot, but most of those men are very, very successfully treated with their first treatment.
Right. Okay, so you've answered my next question. Is that higher than for England stroke the UK, and you said that it is, but and I think you've touched on this just now, but once it's diagnosed, how easy is it to treat?
Well, the real key, as with most cancers, is the earlier a cancer is caught, the easier it is to treat. Now, testicles, obviously, because they're hanging on the outside, you can feel them. And as a result, most of the time, men notice changes early. And that's the critical point, is when you notice a change, you've got to get it looked at that point. Because if you've got a very small lump in the testicle, that almost certainly will be confined within the testicle and therefore can be treated either with surgery. Now, sometimes, normally that would be to remove the whole of the testicle. But actually, with the advent of really specialist services like we offer at the Christie, we are now able to preserve men's testicles and just remove the lumps. So with the very small tumours that present really early, they come and see us here at the Christie, and we're able to salvage the rest of the testicle, which is something that's been happening increasingly. Now, the flip side to that is men who delay presentation because they're worried, they don't want to present, they feel embarrassed about it. They're at far higher risk of the disease spreading outside of the testicle. Now, if you get a bigger tumour in the testicle, or one that's spread, the likelihood is you're going to need further treatment in addition to just a simple operation to sort it. Now, that still is very, very successful. But obviously, the longer a disease is left, the more advanced it will be, and the more aggressive treatment we need to do. And obviously, the success rates unfortunately do fall as you get more advanced disease. But certainly, the earlier presentation means we can quite often get away with just surgery or maybe a small dose of preventative chemotherapy to prevent something from coming back again.
Okay. So you answered the next one as well. If it's caught in time, then the success rate is really high. Yeah. That's great.
And certainly, for stage 1 disease, which is when it's confined within the testicle, realistically, we're always looking for curative treatment. The over long-term success rates are well into the very, very high 90s for those men. So early presentation is critical. Yeah.
So I think the next thing then is what would you say to Manchester men who are at risk then? What's the key messages or message that you would say out?
Well, absolutely. The fundamental point is know your balls. It's really important that any man, whether they're at risk or not, regularly self-examines. Now, when you look at the testicles comprise really of 3 bits. You've got the actual ball itself. There's tubing on the back of the ball that we call the epididymis, and then there's a cord that goes upwards. Now, the important thing is that a man examines the ball itself, the testis. And that's the egg-shaped lump down there, because if you do feel any nodules, any firmness or any irregularity, that really does need to be checked out, and checked out as soon as possible. Doctors are absolutely used to examining testicles, seeing testicles. There's no concern to us. There should be no embarrassment about going and getting checked, because it could fundamentally save your life to get that done. Now, if you are one of those at-risk groups, the ones you talk about had previous testicle problems or you've got family history, it's even more important that you regularly self-examine. And if there's any concerns, you see your doctor as soon as possible.
So it sounds like we need to do some direct promotional work to those at-risk groups, and it sounds like we need to do some myth busting out there as well, doesn't it, about this, and getting over those barriers. Have there been any success stories about getting around those barriers, about people being hesitant about presenting and so on?
Well, I think, certainly when you look at some of the campaigns that have happened over recent years, so Movember, and now people think of Movember about moustaches, but obviously the real point about that is men's health awareness. Now, that's had 2 big impacts. It's got men talking about men's specific cancer problems, but also it's generated an awful lot of money. And here at the Christie, we have been very, very, very lucky to have received that money, and it's really helped our research into these areas. Now, you only need to look at testicular cancer as being one of the real true success stories of cancer research over the last 30, 40 years. That, before in the 1970s, men who had anything but localized prostate cancer had a very high chance of dying. Testicular cancer had a very high chance of dying. Whereas actually now the success rate with the newer chemotherapy agents, which have all come on from research that's largely been done in the UK, the success rates are phenomenally better. And it's a shining example of what cancer research can do. So that certainly is a really big factor. But the awareness campaigns also have meant that men are far more likely to come forward. Men need to know that it's not something to be that will go away. It's not something they need to be ashamed about. And actually getting checked and checked quickly can make the world of difference to them.
That's brilliant. Thank you so much. We'll make sure those messages get out there, and we'll make sure that men get talking about this in Manchester as soon as.
That's
Thank
brilliant.
you for your time.
No problem at all.